Hello, everyone. I am Dr. Allea Francis. I am a pelvic floor physical therapist at Tonic and Phasic. We are located in Costa Mesa, California. So, a couple of things is when we're talking about C-sections, C-section recovery is not linear and it's multi-layered, literally and figuratively. And healing does continue past that 6 weeks of clearance from your doctor. The purpose of our session today is to understand what is happening to your body during a C-section, as that does matter with the exercises, the stretches, the parameters that we will be going over later, why scar tissue matters and why it matters to move it, and learn what you can safely do at home, including scar tissue massage, some helpful tips, and some stretches for scar tissue, and then additionally when to seek support. And a little disclaimer, this is for educational purposes only. This is not medical advice or to replace medical care. So let's get started. We are going to start off with C-section anatomy. So this is a little visual that Molly has created for us. So we have multiple layers with a C-section. So our first layer is our skin. And whenever they are making this incision, they are doing a horizontal incision. It can be anywhere between 4 and 6 inches in length. The next piece of tissue is our fat or our subcutaneous tissue, fat connective tissue. Our next layer is fascia, and fascia is more connective tissue, but it's more responsible for tension and stability. This is a lot thicker than the other two layers before. The second is muscle. And so the muscle layer actually is not cut, but it is separated along the linea alba. And the linea alba is that dense connective tissue that you may see in your abdominal wall. And so that is separated like this. And that will be important for later as well, depending on that incision or opening lines. The next layer is our peritoneum, and our peritoneum is again another thick protective tissue that separates our organs from the outside. So this is a lot thicker. And then we have our uterus right here. So another horizontal line right above the bladder. So during a C-section, they're gently moving the bladder out of the way and then making incision right at the top of the uterus. And then we have beyond the uterus is the amniotic sac, and then that is cut, and then we have baby. So there are multiple layers in a C-section, which is why I think anatomy matters because not all tissue is healing the same. So our skin may be healing different than our muscle is going to be healing differently than our uterus. Okay, so it is important to address scar tissue for multiple reasons. We want all of our tissue to be able to move, slide, and glide. We know that our abdominal wall is a co-contractor with our pelvic floor, and our pelvic floor has so many functions. More important ones are bowel, bladder control, any kind of penetrative function. So if there's tension or restrictions in your abdominal wall, that can affect those functions as well. And really, what we need to address with scar tissue is to prevent pain or pulling with movement. We don't want any numbness or burning or hypersensitivity past those 6 weeks to a month. That is not normal. We also want you to be able to engage your core, which is why scar tissue is important. Again, we want the skin and that muscle layer to be able to slide and glide. So think twisting movements, lifting, carrying. Um, so that is why it's important to adjust from a functional perspective. So now as we're getting into scar tissue massage, I think that's one of the best and most important things we can do. There are different phases of healing of scar tissue. So we have three phases. We have the inflammatory phase, and the inflammatory phase happens between the first day and day 7. So this is very acute. You may have some redness, some swelling, tenderness along the lines, and that's totally normal. And then we have our second phase, which is our proliferative phase. And proliferative phase is as collagen is starting to lay down and new tissue is starting to be developed. This happens from essentially week 2 to week 6. And again, this is variable from person to person. And then the third phase is week 7 and on. And essentially, the most that can happen is in that proliferative phase and that remodeling phase. I should say this too, remodeling phase technically ends for scars at 18 months. So in that first week of after the C-section, we really want to prioritize rest and healing, and just making sure that the bandage is staying clear or staying dry and you're not moving as aggressively, and really rest is prioritized, asking for help during that time. I will later be giving you a couple of tips to help during that time, just because it is painful during that time. That is what everyone says across the board. So bowel movements may be hard, coughing, sneezing, transitional movements. So like I said, I'm going to give tips for that at the end. But then once you are in this proliferative phase, so from week 1 to week 6, there are some things that you can actually be doing before you get cleared to work on that tissue. So we can start off with some desensitization techniques, not on the scar, but above the scar. So we're going to use this as our scar. So let's say you had a C-section and it is along your lower abdomen, and you are now in week 2, let's even say week 3, because those first 2 weeks are pretty tough. We want to stay about 2 inches above the scar. So I just like to coach people through is just gently rubbing on the upper abdomen. You can actually take like a warm um, blanket even, and just rub that across your abdomen, just start to get some desensitization. You can also do a colon massage if tolerating, because we know that whenever you have a C-section, pain medication may be used. And with pain medication, you may have constipation, and constipation can increase pain in that area. So I'll instruct on that really quick. So and this can also help with that tissue. So I'm going to stand up. So this is my left side. This is my right side. So let's say the scar was right here, lower abdomen. You can start in this lower left-hand corner, just right where that waist bone is, just kind of pumping this side. You're then going to move to your right side and you're going to pump right here. So we're staying away from the scar. We essentially have 2 inches surrounding the radius of the scar. We're going to move up, 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 and then across transverse colon, and then back down. Again, avoiding that scar, but that can also help move some gas that may be stuck from the C-section. And we know that gas is one of the most painful things from a C-section. So you can do some light abdominal work, very, very light. Definitely feel intuitive when you're doing that. I like to say I'm like keeping it about that soft. So I'm not pushing in, but just like grazing the skin, that more superficial layer. Another thing that you can do too is some diaphragmatic breathing. I call it 360 breathing. And so essentially what you would do is, I'm going to stand up again. So you're going to just cup your hands along your ribs, and you're going to inhale into your hands, keeping your chest down. Stomach raises a little bit, and then you exhale. And you can do that in any position that you feel comfortable. And even that little bit of movement, diaphragmatic breathing, that 360 breath, can help expand all of that tissue expand and let it kind of recoil back down. And it can also help with some of the gas as well. So that is the first thing, some of the first things that you can do, we'll say from um, day one to week two. And then essentially, you're just going to want to gradually increase the sensation, still keeping that 2-inch parameter around your scar because we really want that tissue to heal as best as we can. And it's just a little bit more important because there's multiple layers. Um, and we want to make sure that the organs are really healing and there's no bleeding, or excessive pain involved. So we kind of has you're just going to gradually increase your pressure. You can keep with those same things. I'm going to repeat myself. So 360 breathing, colon massage, and desensitizing 2 inches around the scar. Now, once you have been cleared from your physician to start the scar tissue massage, so typically if you have sutures, they will dissolve. If there's staples, then your OB will want to remove those, and then you will be cleared. And so then we can actually start the scar tissue massage. So because you've been putting in work, you can essentially come now within the parameters of the scar. So I always say on that first day that you have been cleared, be really gentle. That tissue is going to be um, tender, could be painful. You could have some lack of sensation from the medication from the procedure. So we want to start above, and I like to just go side to side, just grazing the tissue right above, and then on the sides, and then below as well. And that could be essentially your first day. When it comes to scar tissue mobilization, we want it to be between 10 to 15 minutes every day, every other day, as much as you possibly can to make as much change. So, keeping those parameters, we'll say the next day you can start to come onto the tissue. So, you can go onto the scar and start to go up and down. You can go side to side, and then you can start to lift. Lift the skin itself. So similar to this. And I'll show you on my arm what that looks like. So you would just pick it up and then you would just roll it. So we've got that up and down motion, side to side, a roll, and then we also have these circular motions that you can do along the scar. Again, it's really important to not only be on the scar, but to be above the scar, on the sides, and below, because we know that this scar or this line of incision does not necessarily match this line, right? So we want to be all around where things were moved or separated. Now, specific parameters for scar tissue is that we have to stay per 1 inch at a time for 2 minutes. So we'll say if this is about a 1 inch part of the scar, we need to work this part of the scar for about 2 minutes. And then another 2 minutes, another two, and another two. So that puts us at 8 minutes. And then we can go above, and then we can go below. I would definitely prioritize more of that above tissue just because of gravity, just because we know of the muscle tension above. So even working up here, I have worked with people who actually have the most tension in that musculoskeletal area, and we will often work up and down as well. So those are our scar tissue parameters. Again, this is so important to be able to move effectively, engage your core properly, get blood flow, have it lay a little bit more smooth to help with bowel movements, urination. So it really serves such this bigger purpose than what we naturally think. All right. Okay, so let's go over some helpful tips and tricks. So we're going to go back. So essentially, you're in that first 2 weeks postpartum. And we know that area is going to be so tender. Moving is going to be hard. Going to the bathroom is going to be hard. So, what I like to say is keep a little pillow, like a couch pillow, in your bathroom, in your living room, on your bed, anytime you potentially may be moving or coughing or sneezing. And essentially, what we'll do is we'll use that. I'm just going to demonstrate. Use that against your abdomen to brace to push out. So let's say I'm going to the bathroom. I'm going to go number two. I've got a couch pillow. I'm going to just put that against. And then as I'm voiding, I'm using that pillow for support to push against. And that will definitely help with ease of bowel movement and um, less tension, less pain with increased intra-abdominal pressure movements like coughing or sneezing. Um, so that would be like my first priority. The second one is that I actually found is chewing gum. So research says that people who chew gum 3 times a day for 30 minutes at a time actually have better bowel movements and better healing recovery because they're changing intra-abdominal pressure and it's facilitating their bowel movements, which is going to help offload that scar. So that is a fun fact. And then, of course, movement is going to happen. People are postpartum, so that can be really hard to tell someone just to purely rest in those first 2 weeks. Definitely rest, but it's almost inevitable that you'll have to get up. So when you are getting up, we definitely want to make sure that you are moving upon the exhale. So let's say I am in those first fresh 2 weeks from a C-section, and I'm going to stand up. I'm going to inhale, exhale, stand up on that exhale, holding that, and then I can inhale, release, and go on. And just that exhale will perform as a core brace to help protect that incision and just make you feel a little bit more supported. So exhale during transitions, sit to stands, getting out of bed, um, or getting in and out of the car even. So there is that. And speaking of braces, we also have the braces that you may go home with, you should go home with at the hospital. So I recommend people wearing those honestly up until they feel comfortable. So truly in those first 2 to 4 weeks, you want to wear that brace, and that's just going to keep everything nice and compressed. And when we're talking about braces or binders, we want this more uniform binder where it's all coming together as one versus those straps that we may see online where you go one strap, another strap, or one strap above or one strap below. Because if they're not uniformed, we can put pressure actually downwards, kind of tipping into some waters of prolapse or heaviness and pressure because just think about your abdomen is open from pregnancy and it's just like a toothpaste tube. If you tighten your abdominal wall in kind of funky places, the only where that pressure is going to go is down. And so we just really want to protect and have this uniform compression so that pressure is staying more organized. Um, some other health tips for bowel movements and digestion, of course, is staying hydrated as much as possible. That's going to help facilitate bowel movements, again, making that easier on your C-section scar. Some gentle movement, which we'll get in specifics later, but gentle movement really can happen from 2 weeks and on. Really, those first 2 weeks, you need to really be resting, just doing what you can, kind of the bare minimum. And I would say with walking, I think I get this question a lot is how soon should people be moving or exercising? And honestly, less is more at this time. I always think we have our whole lives to move. And even though movement is really important, at this point, because there was pregnancy, there is postpartum, and now there is an abdominal surgery that you also have to heal from. So really prioritizing rest. If you're a type of person who movement is kind of their peace of mind, no more than 10 minutes at a time. Your body will let you know the next day. And so again, we're just really trying to avoid any kind of opening of the suturing because that's at risk for infection, which we're trying to avoid. Um, my general guidelines are pain-free movement, slow and controlled motion, and just that 360 breathing. So, to be a little bit more specific with pain-free movement, because everyone's pain threshold is a little different, we have a scale from 0 to 10, 10 being the most pain, 0 being completely pain-free. I tell people when they are doing scar tissue massage, or exercises or stretches, you will be surprised at how tender it is the next day. But I want you to stay no more than a 4. So the kind of sweet spot is between a 2 and a 3 because that's a little uncomfortable. This process is rehab. It should be a little uncomfortable. Um, and so, yeah, we just want to stay between that 2 and 3. 4, if you were really pushing it, and if you did hit that 4, then we need to pull it back definitely the next day. So nothing more than a 5. 5, you did way too much. We have to take a break for the next 24 to 48 hours. Um, okay, so some early interventions post C-section. So again, we're thinking that that first week to first 6 weeks, what you can do are 360 breathing. You can do pelvic tilts. So if you're sitting here right now, or if you're laying down or standing up, you're just going to put your hands on your waist bones and you're just going to rock your pelvis back and forth. And those are pelvic tilts. And just even that moment um, is good enough to keep that tissue moving. So that's more early intervention. Or if you are new to movement, then that is a great place to start. I like to link the breath work with pelvic tilts. So as you're rocking your pelvis forward, you're sitting more on your vulva at this part versus your tailbone. So you're going to inhale as your pelvis is tilting forward, and you're going to exhale as you're sitting more onto your tailbone. So inhale. And then exhale. So you're kind of killing two birds with one stone. We're getting that intra-abdominal expansion, and then we're getting external movement, and we're going to start to coordinate those two pieces. So those are two really great things that we can do early intervention. And here's a little tip as well. You can inhale and exhale in this nice relaxed way. But if you exhale with more of this pursed lip, like you're blowing out candles, the longer your exhale is and closer to the end, you're actually going to start to get some muscle activation, which is what we want, again, for transitional movements or as we're integrating back into exercise. So you can kind of play around with the two options, a more passive exhale versus a more active exhale. And you can do that at any point in the time that you feel comfortable. You will not be doing any harm with that. Some gentle stretches that we can do. So let's say now we are out of that acute period, that inflammatory period. You can start these stretches between um, week 4 to week 6, and this is totally depending on you, and this is depending on your provider as well. But always like to start off with a cat cow. So you are on all fours and you are inhaling and you're extending upwards, you're looking up, and then you're exhaling, you're tucking and you're curling down. And then I like to do those for 10 breaths total. The other thing you can do is a child's pose. So your knees are out wide, your ankles are together, your face down, abdomen down, your arms are stretched out, and you're just going to take some breaths here. And you can actually get some side bends and right and some side bends and left. And those are some really great, those two together are just universal across the board, very safe. The other, some other exercises or stretches that I like is a thread the needle. So we're going to go on all fours. We're going to open up and then we're going to exhale, thread through. I'm definitely going to demonstrate all of these at the end, but I kind of want to walk you through them first. And then the other is a cobra's pose and then a seated side bend. So let me walk you all through that. So we have a cat cow. So we have the inhale and then an exhale, inhale, exhale. And I can definitely even feel that stretch in my abdomen. Then we'll go into a child's pose, heads down, and my abdomen is just kind of hanging. And then we'll stretch right, and then we can stretch left. Obviously, we will be going slower when you are integrating these at home. The next stretch is a thread the needle. So we're going to go up and then through. And then we're going to do the same thing. So we are up and we thread through. Now that one can be a little spicy because we're starting to get into some rotation and twisting. So if that is a little intense for you, you can just put your hand on the back of your head and we just rotate up and then just elbow to opposing wrist. And then we have our cobra or sphinx pose. So you could put a little pillow right here just to soften, or even a yoga mat. And so you can start here and just leaning up, or you can take your hands to the side, nose down, and then we're just pressing up. I barely have any weight into my hands, but I'm using for support. I'm going to start to lean up until I start to feel that abdominal stretch. And we do want to be very cautious of that time too, because or of that stretch, because if you do have a diastasis, so an opening in your rectus abdominis postpartum, a lot of women do, we just want to be mindful of that extension. I would say just staying about right here, kind of anchoring your pelvis into the ground, squeezing your glutes, and that should be enough. You don't have to do this big bend, again, just to be cautious of a diastasis. And then the other one would be a seated side bend. So I'm going to move us up. And essentially, if I'm sitting, just kind of stretching, taking this arm up and over, elongating that right side. And the same thing, elongating the left side. I will always say this, it is quality over quantity. You may feel some incision pulling, some tension. And again, we're staying between that 0 and 3 range. You should feel a little bit, but we always want to walk right up to that pulling or tension and then start to walk back. We do not have to really pull it to get that benefit. And we just want to progress gradually. So I think that is all I have for our webinar. So thank you so much for joining. I am going to end this recording now and then we can get into some Q&A.